I'm sure everyone will be wanting to get some lunch, so I'm sure I can whiz through this in 5 minutes. I know I did last night on the practice one. We are honoured to be announced winners, and I have been busy tweeting and texting the rest of the team, because it's not just us, you know, we've got a huge team who also delivered this. My name is Nicola Gardner, and I work for North England Commission Support. My colleague Lynn Cook also works for North England Commission Support, and we worked with NHS Newcastle and Gateshead CCG to on the Deciding Together listening event. So we delivered a high-profile listening exercises on specialist mental health services in Newcastle and Gateshead, and this took place between November 2014 and February 2015. It was a listening exercise, and it was called Deciding Together, Developing a New Vision for Mental Health Services. We recognise the significant challenges around NHS funding, so we organised participatory events called How to Spend the Mental Health Pound. This was the first time the NHS in the UK had used participatory budgeting for mental health services. Now, what I mean by participatory budgeting is it directly involves local people in making decisions on the spending of the defined budget. It's a way enabling hard-to-reach groups to engage and interact with agencies to develop community projects of commission ideas, and an opportunity for public officials to let go and empower communities. It's about putting people in the shoes of the commissioners in charge of health spending for the day. I'm going to play a very short video from Dr. Guy Pilkington. He's a GP and chair for NHS Newcastle and Gateshead, and he's going to explain why services need to change in mental health.
My name is Dr. Guy Pilkington. I'm a GP in Newcastle, and I chair Newcastle Gateshead Clinical Commissioning Group. A few years ago, we created the Mental Health Programme Board, and I've been very involved in the work of the board and would like to tell you about why we feel we need to transform the way people access specialist mental health services. For far too long, mental health care has been described as a Cinderella service at the expense of health care for people living with physical complaints. And despite the best efforts of a skilled and committed workforce, we know that we don't keep people as well as they could be as often as we need to. As a result, we have found that people move into hospital settings far more than we would like. We need to invest more in looking after people in the community. And by doing so, we believe that we can end up relying less on hospital care for people living with mental health issues. In order to invest more in communities, we have to spend less on hospital care. Some of our hospital facilities are not up to the standards that we would expect in this day and age and need to be improved. We also have facilities that are too spread out across Newcastle and Gateshead to allow us to build the very best specialist health services if people do need to go into hospital. I realise that talking in this way may well cause a great deal of concern in many of you, but I want to assure you that the whole Deciding Together process is designed to share as much information as we have to explain the kind of decisions that we need to make together. We will continue to offer the full range of mental health care that we do now, but we hope to be able to, in addition, offer new ways of supporting people that will ensure that people are kept as healthy and as well as possible at all times. In order to do this well, we need your help. Hearing from people who have worked in mental health care or in social care is only one point of view, and we need to hear from you, from people who have experience of living with mental health issues, or from someone close to you that you have cared for who has had mental health concerns. And also we need to hear from people who haven't got those experiences but are interested in how the very best healthcare can be delivered. We need your help. We need to hear from all of you, because if we understand what matters most to you, if we understand what concerns you have, then we will be able to make better decisions about how we grow our investment in community services and yet still provide the highest quality of specialised mental health care that we can. So thank you. Thank you for your contribution. Thank you for your help, because we can build a better system for people living with mental health issues in Newcastle and Gateshead. Together we can think differently about mental health.
So the objective was to ensure a co-productive engagement and consultation process across all public and third sector parties. It was to ensure a safe pre-engagement listening process to gather robust insight to inform future scenarios for change, and to ensure the listening process is carried out in a positive and non-stigmatising way which reflects the social model of disability. This is about making it inclusive to everyone and having real service users in attendance. So we worked with lots of partners from public and third sector organisations, as well as the Mental Health Trust and Health Watch. And the listening exercise include the following areas, and you can read through them yourself at leisure: access to services and getting care urgently, specialist community health services, the current adult inpatient units, ensuring a place of safety, section 136 suites, services for people with especially complex mental health needs, services for older people including memory services, and transition from children's service to adult services, and transport and travel. So we used a full range of communications and engagement methods, including, so this wasn't the only pre-engagement technique we used. We also used a load of other ones: online and paper surveys, focus groups which were delivered by community and voluntary organisation to make sure that we reached further in the community. We had market stall events and the participatory budgeting events, how to spend the mental health pound, which what we did on that was we broke down, we used real health budgets and we broke it down into pence into the pound, and we put that pence in the pound on each service. So people in attendance could pick out, you can see the boxes to my right, inpatient service bundle, and within that inpatient service bundle they had to build in community services. It's about keeping out of hospital care, and what they had to do, they had to build up to £1. So whilst sometimes, when we do any sort of pre-engagement, everyone wants everything in their area, but this made them be empowered to think, well, actually, do I really need that? And we had professionals around the table who explained about the different services. So give them the power to think of how to spend that pound, and they couldn't go over the pound, and actually some didn't even spend the pound, which was really good. So the outputs, we had 342 contacts, 61 people attended 8 focus groups, 90 people attended market stalls, 103 to in-depth interviews, 7 organisations provided response by letter, and 81 people attended participatory budgeting events. And we had independently organised third sector event and report to contribute to the input. So the outcomes we gained was an insight which has helped to develop scenarios for a formal NHS public consultation, which has just been through and is now closed. It provides the NHS with strong reassurance of legally safe engagement processes for this very highly sensitive area of healthcare reconfiguration. And next is used in participatory budgeting in other areas of healthcare commissioning. And the other area which we've used this technique is in North Tyneside, where we've used it on their urgent care services. And the CCG has used more asset-based approaches with a third sector for engagement delivery. We strengthen partnership working and trust between partners, and the advisory group model has also been rolled out in other areas of mental health reform in children and young people. So I'll just quickly go through this, and that is the end. Thank you.
Timing, perfect. Well done.